afternoon, friends. This lecture is about TPSS in hand injuries using the very special Tangari Prakash clamps and wires. This video will be about a thumb metacarpal intra-articular fracture, normally neglected and ending up with a disastrous stiffness and the patient cursing you or either treated by screws. Here is a non-invasive joint bypass method using a dual clamp 4-wire montage. The first step is to correct the intra-articular fracture with a bent wire which will act as an olive. We are in the process of producing mini push olives in 1.5 millimeters to be incorporated into these Tangari clamps. Here I am showing you the method of just using a simple wire. Now the wire inserted from volar to dorsal over the displaced intra-articular fragment, and the end of the wire shall be bent at right angles, and then we shall pull the wire from the dorsal side to achieve an interfragmentary compression or buttressing and a very accurate reduction of the fracture. The next step is to bend the wire at 90 degrees. Sometimes the thing is very small, the wire bender may not be enough to bend, especially in a mobile model. In real patient, you should be able to do it. Now I am bending the wire. Now as this wire is too large, it shall be shortened and trimmed to ensure that we are pulling it out from the dorsal side. We make a very small nick as we make for olive wires, and once we pull the wire, we will be able to compress the intra-articular segment. We must not twist too much. A gentle pull, the wire will go in, touch the bone, and reduce the intra-articular fragment. Now we need to use another parallel wire, which will be a shaft wire, and then just as we do with the knee intra-articular fracture of tibia where we span the knee, we shall be spanning this joint by a fixator to give it rest till the fracture heals, while the rest of hand stays completely mobile. Between these two fragments, the intra-articular fracture has been stabilized. However, we need to span the joint and bypass this intra-articular fragment because we do not want it to displace during the course of aggressive physiotherapy, which is always essential in all hand injuries. So now we have gone into the thumb metacarpal. So we will now be spanning the metacarpophalangeal joint. Hand surgeons who have been using these methods will really appreciate the TPTS system because this is far more elegant than opening up from the volar side and putting interfragmentary screws or making open incisions. Here, no skin incisions are made. This is a bloodless surgery and very easy to do. We are using a pair of dual clamps, means each clamp has got 2 sets of washers and is capable of clamping 4 wires in 2 parallel sets in any direction desired by the surgeon. The wires are so special that once you press them, they clamp. I had not bent the wires properly, so I am now bending the wires to get to the right axis and angle where the 2 clamps will be in such a position that they can be attached or anchored with an additional pair of parallel wires. And in this way, we will have a stable joint spanning ecosystem with just two clamps outside the body, four wires in the bone, and two wires which will be joining one clamp to the other. The entire assembly is extremely lightweight and the surgical steps are very easy using the very special instruments and implants provided by the Indian Academy of Orthopedic Surgeons. In this case, because the hand is free and is not fixed to a stand, and I'm doing the procedure individually without an assistant, there have been minor mishaps. However, I have not edited anything. The video is being shown in real time to show how easy the procedure is. The entire procedure can be performed under local anesthesia extremely easily, and the clamps have an extraordinarily high pull-out strength, ensuring that the instant the clamp is fixed to the wires and then the clamps are fixed to one another, the frame assumes such immense stability that it is more stable than components rigidly fixed with plates and screws. In addition, not only is it lightweight, but is amenable to a lot of modifications. The wires can be snapped edgewise. You are just line them to the washer and give it a snap. The whole thing gets in beautifully. I hope the screen is large enough for you to understand the intricacies of the procedure. We have had two wires into the shaft of the metacarpal, one bent wire acting as an olive wire for interfragmentary compression in the proximal phalanx, and the second wire in the shaft of the proximal phalanx. External wires will stabilize our reduction and ensure that the bent olive is held firmly and rigidly, and from this instant the patient's wrist and all other metacarpophalangeal joints are free for full movements, and the possibility of stiffness of the hand is near zero. You can see how this montage is made beautifully. Secret of success in TPSS system is that the wires have to be bent at 90 degrees, and eventually the wire exit points have to be parallel, a little away from the body, so that to allow hygienic activities, and the patient can wash, shower, or have bath from the next day itself, as despite its lightness and being uniaxial, the fixator is almost as stable as an Elizarov fixator. The next part of the video shows an intra-articular fracture of the thumb, again badly displaced, prone to stiffness if improperly treated, needs expertise by a hand surgeon, two tiny fragments for screws. Here again we have used a bent olive to buttress. We have transfixed the joint with a thin wire and the two clamps are now joined. Once again you can see the montage. The first wire is going to be a bent wire which will act like an olive wire and will pull the intra-articular fragment from one side to the other. The whole procedure can be performed under local anesthesia or ring block. After the fracture is reduced by our thumb and index finger, a wire is now pulled straight from the tip of the thumb and goes through the terminal phalanx and transfixes the first metacarpophalangeal joint. Now we have to use a buttress to buttress the displaced intra-articular segment, and for this we use a 1.5 millimeter wire from volar to dorsal, and the wire can be bent at 90 degrees and pulled from the other side so that there is a buttressing. The Indian Academy also supplies these very special silicon models for you to perform and practice and learn at home. The bent wire is now cut to leave it a very small tip and with a very small incision as you make for an olive wire. This wire is pushed in, and as it is pulled, it will reduce the intra-articular fracture and cause an olive wire buttressing. Now, as these two wires are at right angle, it is preferable to have two clamps and join them. In case you use larger wires, the wires can also be bent in an arc and they can be joined. The system is like a mechanoset, and now we have got an olive compression with the wires. Now these two wires have to be joined. This is again recorded in real time, and in case of errors, I have not edited them and I have allowed the errors to remain so that you to understand what mistakes I made and avoid making those mistakes. Very easy to clamp these to the wires edgeways as it snaps in, and once snapping in, you cannot pull it out because of the extreme high pull-out strength. Once it is tightened, we have an excellent resource of a very stably reduced fracture. Now, through these dual clamps, two wires are going to be snapped and they are going to be bent and snapped comfortably and logically. However, my first attempts have not been successful because the grooves are at a different level and the wire has to be bent so that the two grooves now become slightly parallel to each other, and once they become parallel, we should be able to match both of them in line. Now I am passing the connecting wires, but again find that unless the connecting wire is bent, I shall not be able to give a proper flexion and proper position to the clamp. My bending in a right angle does get the two wires parallel and the system stable. However, as the wire has been bent inwards, it is touching the skin and there is not enough space between the wire and the skin. So I will tighten this. Probably, if it was a patient, image him under CM, understand the situation, and then and only then take a next step. I am not satisfied with this wire because it is too close, so I will move the wire. And now that they have been bent, we can always use the bent wire in the opposite direction so that the curvature, instead of being towards the finger and pressing the finger, is away from the finger, leaving a lot of space. This can be tightened comfortably and you will find a properly reduced fracture without immobilizing anything more than the metacarpophalangeal joint of the thumb, leaving the hand totally free to assume all functions that the hand was used to before injury. At the end of 3 to 4 weeks, when full union is there, we can remove the unit and ensure that the patient recovers full amount of movements. These are still pictures from the completed montage, which will show you how beautifully just two simple clamps and three wires have produced an accurate reduction and a precise fixation in a minimally invasive manner. The X-rays of a similar patient show the fracture in both AP and lateral views. Here, of course, the olive was inserted from dorsal to volar side. So this talk has taught you some basic principles of the Tangari Prakash system. And should you be interested in doing the course and learning the system, or interested in buying the instrumentation and implants, please message me in WhatsApp on the number given in this talk. Thank you.